Top 5 vitamins every senior must take after 60. Did you know that missing just 5 key vitamins after 60 can make your body age faster by up to a decade? I'm not exaggerating. I've seen it firsthand not once, but in hundreds of retired patients coming to me with the same question. I eat well, but I still feel tired. My memory's fading. I sleep poorly. My joints ache. Why? And the answer often comes from something they've always seen as unimportant: vitamins. I once asked a 68-year-old patient, if you could go back, what would you change about how you took care of yourself? He stared out the window for a moment, then softly said, I wish I hadn't brushed off the little things, like those vitamin pills. That stuck with me for years. Because the truth is, after 60, your body doesn't absorb nutrients the way it used to. What was enough back then is now not nearly enough. Hi, I'm Dr. Sam Wells. After over 25 years of working with older adults, I've learned one simple truth: to stay healthy in old age, you don't need big, dramatic changes, just a better awareness of the key nutrients your body really needs. What I'll share today isn't theory. It's what I've seen and heard directly from my patients. If you're 60 or older, or if you have parents or loved ones entering this stage, I invite you to drop your questions in the comments below. Share this video if you think it might help someone stay healthy. And don't forget to hit subscribe to follow Wellness Unfolds, where I share free daily health tips that are simple and practical. Let's begin. Vitamin D. When sunshine is no longer enough. Picture a winter morning in Minnesota. The sky is bright, but the air is freezing. Linda, 70, one of my patients, sat in the clinic rubbing her knees, smiling as she said, I still go out to the garden every morning. Doc, but my knees still ached, and I still can't sleep. We ran some tests. Her vitamin D level was barely a third of what it should have been. She was shocked. But I drink milk, and I get sunshine every day. How can I be deficient? I sat down and explained gently. After 60, your skin no longer makes vitamin D efficiently, even if you get sunlight daily. That light, especially in fall and winter, isn't strong enough to trigger the vitamin D your body needs. And your gut doesn't absorb it the way it used to either. Vitamin D isn't just for strong bones. It affects your immune system, your sleep, your mood, even your hormones. When you're low on D, your joints hurt more, your knees get sore, and your sleep becomes restless. Some studies even show that seniors low on D have a higher risk of depression and cognitive decline. Linda began taking 2,000 IU of vitamin D daily. 6 months later, she came back smiling. I'm sleeping better. And I think I'm less cranky too. Have you ever felt tired for no reason? Slept poorly? Or woken up achy in the morning? Don't blame it all on age. Talk to your doctor about vitamin D sometimes. A small change can make a big difference in how you feel. If this story reminds you of someone, a loved one, a friend, don't hesitate to share this video with them. And if you have questions about vitamin D or anything related to health after 60, leave a comment below. I do read and respond. Hit subscribe to follow Wellness Unfolds, where I share health knowledge every single day, based on real stories and real lives. Next, we'll move on to another vitamin one that, if you're missing it, might just make you forget your own grandchild's name: vitamin B12. When you start forgetting your grandkid's name, I still remember that afternoon clearly. Mr. Thomas, 74 years old, came into my clinic looking worried. He sat down, held my hand, and asked, Doctor, am I starting to lose my mind? Lately, I forget things. I say something and then forget what I was talking about. Sometimes I'm just standing in the kitchen with no idea what I came in for. I looked at him and gently asked, have you ever checked your vitamin B12 levels? He gave a nervous smile. Vitamin what? I've only ever heard people talk about Alzheimer's. The truth is, the symptoms he was experiencing: memory slips, forgetfulness, even feeling anxious or low energy, are super common in people who are low on vitamin B12. And the surprising part is, B12 deficiency is incredibly common in older adults, even if they eat well. Why? Because after 60, your stomach produces less acid, which makes it harder to absorb B12 from food. We ran a test, and just as I suspected his B12 level was too low, I put him on a sublingual B12 supplement, which absorbs better than standard pills. 2 months later, he returned with a relieved smile. Doc, I'm not so anxious anymore. I remember my grandkid's name. I remember when to take my meds, and my wife says I seem more cheerful. Have you ever felt like your mind's just not as sharp as it used to be? Ever forget simple things where you left your keys or an important appointment? Don't be too quick to chalk it up to just getting old. Sometimes it's just your body's way of saying it's missing something important. B12 isn't magic, but in many cases, it's the first step toward a clearer, calmer, more focused mind. If Mr. Thomas's story sounds familiar, leave a comment below. I'd love to hear your experience. And if you think this video might help someone regain their clarity, please share it. Hit subscribe to keep following Wellness Unfolds, where I share real, lived in health wisdom for aging well every single day. Up next, I'm going to tell you about a vitamin people often overlook because they think I just need to eat fruit and I'm good. But the truth is, when you're missing it, your body starts showing signs: bruises that won't heal, bleeding gums, and tired, lifeless skin. Vitamin C. Bruises that won't heal aren't just a coincidence. I want you to picture a familiar scene. You bump your leg lightly against a table. A few hours later, a bruise shows up. A week goes by, and it's still there. A lot of older patients have told me stories like this. They think it's normal, but really it's often a sign that their body is low on something essential: vitamin C. One of my patients, Linda, 69 years old, was careful with her diet, but still dealt with bleeding gums and unexplained fatigue. When we ran tests, we found she had a mild but persistent vitamin C deficiency, something most people assume only happens with malnutrition. Here's the thing: after 60, your body doesn't absorb or store vitamin C the way it used to. If you eat few vegetables, smoke, or live with chronic illness, you're likely not getting enough vitamin C to protect your blood vessels, keep your skin healthy, and support your immune system. Vitamin C is the body's collagen builder. It holds together your skin, tendons, blood vessels, and cartilage. Without enough of it, your wounds take longer to heal, your skin ages faster, and even minor injuries can become lingering issues. Something I always tell my patients: vitamin C isn't just for fighting off a cold. It's the silent shield that guards you from aging and inflammation. After starting a daily, easily absorbed vitamin C supplement, Linda told me she not only felt more energetic, but she was sleeping better and enjoying food again. A small change with lasting impact. Do you eat fresh fruit daily? Have you noticed your skin aging faster than before? That could be your body's quiet way of saying, I need more vitamin C. Drop a comment if you've had symptoms like these, and if you want no fuss, real world health advice for aging well. Hit subscribe to Wellness Unfolds. I'm here every day walking alongside you on your journey to aging gracefully. Coming up next, I'll talk about a vitamin that won't make you look younger, but without it, your heart may slow down, your muscles may weaken, and that constant fatigue might never go away. Can you guess which one it is? Let's move on. Vitamin K2, the key to keeping calcium where it belongs. One of my patients, Mr. George, 68, was very serious about his health. Every day he took his calcium and vitamin D3 without fail, ate clean, and even walked 5,000 steps each morning. But his bone density was still low. Sometimes he'd ask me, did I do something wrong? Doctor, I take every pill every day. After reviewing his full health records, I found what was missing: vitamin K2. You might not be familiar with it, but K2 is absolutely essential. If calcium is the material that builds bones, and D3 is the delivery truck that moves it into the blood, then K2 is the traffic controller that directs it to the right spot. Without K2, calcium can get lost sticking to artery walls instead of going to the bones, leading to calcification, artery hardening, and a higher stroke risk. I started George on a daily dose of K2, along with D3 and calcium. 6 months later, his bone density had clearly improved. Even better, his inflammation markers and heart disease risks dropped. His overall health saw a real change. Are you taking calcium every day? Without realizing you might be missing K2, ask your doctor or leave a question for me in the comments. And if this info helped you, don't forget to share it and subscribe to Wellness Unfolds, where I share daily health tips for life after 60. Up next, I'll talk about one final vitamin. It affects your heart, your muscles, your nerves, and your sleep. If you often have leg cramps, an irregular heartbeat, or restless nights, chances are you're missing it. Let's dive into this last one. Magnesium, the quiet vitamin for deep sleep, cramp relief, and inner peace. I want you to picture this. It's past midnight. You're in bed, but your mind won't stop racing. Your legs feel restless, and every few minutes, a cramp pulls your calf tight like a rope. Know what's behind that? It's magnesium deficiency, a mineral I call the quiet vitamin because no one notices it until they're sleepless, achy, or constantly drained. Magnesium works like a hidden switch in your body. It helps your muscles relax instead of spasm. It calms your nerves instead of firing them up, and it keeps your heartbeat steady instead of erratic. When you're low on magnesium, you might have muscle twitches, shaky hands, fast heartbeat, or even unexplained anxiety. One of my patients, Linda, 69, once described it as like an electric current buzzing inside me. I couldn't rest. As we age, our ability to absorb magnesium from food drops. If you take diuretics, acid blockers, or insulin, you're even more at risk. The scary part is that magnesium deficiency sneaks up on you. It often gets mistaken for stress, aging, or simple fatigue. I had Linda start a low daily dose, especially magnesium glycinate, since it's easy to absorb and gentle on the stomach. 1 month later, she came back smiling. For the first time in years, I slept through the night without waking up. See, a full night's sleep, a body without cramps, a morning without exhaustion. Sometimes, it just takes one small step adding magnesium each day. Are you dealing with cramps, mild anxiety, sleeplessness, or heart flutters? Don't brush it off. Make small changes. Add magnesium, rich foods like pumpkin seeds, avocado, leafy greens, or use a supplement if needed. I still believe this. After 60, the body doesn't need much, but it needs the right things. And magnesium is one of those right things. Now I want to share something I tell all my patients. A mindset shift that can change how you look at aging and how you take care of yourself every day. Listen closely. I always tell my patients, we can't stop aging, but we can choose how we live through it. Some grow old with pain, confusion, and exhaustion. Others stay sharp, steady on their feet, and full of light just because they take care of themselves in the little things. These 5 vitamins aren't magic. They won't make you young again, but without them, your body is like a machine running with no oil. Each day wears you down a little more quietly, but surely. So listen to your body, not with machines or test results, but by how you feel each morning. Do you wake up refreshed? Can you get up easily? Do you forget what you were just about to do? Your body is whispering to you every day. You just have to pay attention. We've just gone through the 5 most important vitamins your body needs after age 60. If you're still unsure where to start, begin with this question. What does my body need right now? You don't have to take everything. You just have to understand what you're missing and give your body the right thing. And if this video helped you, don't forget to hit subscribe to Wellness Unfolds. We share daily tips to help you care for your memory, bones, heart, and sleep one step at a time. In the next video, I'll be talking about the vitamin that helps prevent muscle loss after age 65. You'll be surprised. I'm Dr. Sam Wells, and I truly believe your body can stay healthy as long as you know how to take care of it. Thanks for spending your valuable time with me. I wish you health, peace, and joy. Now let's move on to the next video.